Good evening. My name is Mark Rauterkus. My family and I reside at 108 South 12th Street on the south side. The home on the internet at rauterkus.com. I'm the vice chairman of the Allegheny County Libertarian Party. No need to get out the checkbooks tonight or even a local match. I'm just sort of giving some information. Sorry for my dress. I'm a swim coach and an activist. I want to alert the public's attention. There's a closed indoor ice rink on the south side, and I've called a community meeting to talk about that. The city has issued an RFP. It's on the City of Pittsburgh website, but it's one of the facilities that has countywide appeal. So that meeting will be on Tuesday, April 17th at 7 p.m. at Phillips Elementary. The other thing I wear this swim coaching for is a Beijing China shirt. I understand our county executive is going to China, so I'll be blogging some of the actions of his trip. We've been fortunate enough to go to China 3 times in the last couple of years. Sometimes Allegheny County gets a little bit like China in the sense that there's a lot of red tape. One of the things that was this piece of paper that passed out to you and the people in the audience, it's a nomination paper for candidates who want us to get on the ballot. And
Mr. Rauterkus, we're not going to be political here. We don't allow Democrats, Republicans, anyone else to do political. You can talk about issues, but we're not going to do signature petitions.
Right. Well, the problem is the petition is on somebody's desktop in Harrisburg. It takes 20 seconds to send. And we can't get it out of Harrisburg. We can't get past the red tape. It's just one of the other instances on how difficult it is to get citizen activists. So there's this cut and paste opportunity, and it's just a major mess. And the Allegheny County Department of Elections could be an advocate for citizens that want to get on the ballot, or they could be a hindrance. And that's sort of what I'm here to say now. We've been raising candidates that want to run for office, and in my last minute I was going to just point out that it's citizens that want to run for office for the November general election have about a week to make sure that you file a form with the Department of Elections and that you're not part of the D or the R party, so that you're eligible, and I think the deadline is around April 14th, that you could still run. So I think in Allegheny County we're a lot like they are in China, where there's no opposition coming. So some of us are working hard. We're trying to battle through some of the red tape so that democracy doesn't actually die here in Allegheny County. Now, one of the other things I want to just mention is that we were a little bit late with regards to the single-payer system, and I'm a common-sense libertarian, and my son's going to speak a little bit more on something I endorse as far as the fitness, as far as single-payer health care that was here earlier. Thanks for listening.
Mr. Rauterkus, Erik Rauterkus. And I know him as a good swimmer for Frick. I do know that, so he's healthy as it is. Mr. Rauterkus, could you state your name and address for the record, please?
I'm Erik Rauterkus, and I live at 108 South 12th Street. And I'm here to talk about something that I approve and my dad approves, single-payer health care. Now, I believe, and a lot of other people in America believe, that our health care system is broken. It is too expensive. Insurance rates has raised 73% since 2000. It is wasteful. 30 cents out of every healthcare dollar goes to paperwork and not actually care. And we're not as healthy as we could be here in America. With single payer, everyone is covered regardless of income, job status, age, or health status. You can go to any doctor you want without worrying about copays, deductibles, or premiums. And all healthcare services are covered, including hospital stays, doctor's visits, prescription drugs, long-term care, mental health, hospice, and much more. Now, I believe that it is unacceptable for the United States, a pioneer in lots of things, to be the only advanced country in the world that does not have universal health care. Now, with this program, everyone gets a health care card, and you just have to show the card to your provider, and you will receive care. Now, you will get a modest payroll tax of 3 to 4% on all employers and employees, and this also includes the 1.4% you're already paying for Medicare. And for 95% of the population, this tax will be far less than what we are currently paying for health care. Now, 37th is what America is ranked in health system performance. And with single payer, everyone contributes and everyone gets health care. I would like all you to support single payer with me. That's all. Thank you.
Mr. Rauterkus, you did a great job. I'm going to ask Mr. DeFazio to comment, and you might want to come to our next meeting, Mr. President.
Well, I agree with what you're saying about the healthcare. I have a job for you though. There's like 45 million people that don't have healthcare. 47 now it's up to, and maybe another 45 or 46 million people that have cut healthcare. If they'd have one person, just a mother or father or sister or brother or friend, take one, so you figure 90 million plus one person, that's 180 million. If you could go out and get some of these people registered to vote, you could put anybody you want in this country as President of the United States. Thank you.
Thank you.
Any other business before this council tonight? Do I have a motion to adjourn? Meeting adjourned. Second.